Hello everybody, we're going to talk today about once you have a root canal, what happens when this root canal fails? What are the causes of the failure? We have a root canal perfectly done and then it doesn't work. Well, one of the situations that I want you to be very aware is that if you have a regular infection like this, look at this kid, he has the eye closed. This is a person that probably if the kid wasn't eating well or he let it go, he didn't tell his mom. And if you look at the image, how much inflammation he had here, to get to this point, it's really, really difficult. If the mother is checking the gums of the kids, this wouldn't happen. You know why? Because it can go to the spaces of the brain here on the frontal area, on the back of your brain, and the patient can get septic shock and die. Yes, you have to at that point go to the hospital. Don't even stop at the dental chair unless your dentist will be an endodontist or an oral surgeon that is going to open and drain. These abscess need to be drained immediately. Most of the time, either you put intramuscular antibiotic, it has to be a very strong, which is in Augmentin is in the United States 75, but this sometimes has to be IV. So my recommendation to you is you're going to have to go to the hospital, because when you get to the point like you see in this image with the eye closed, one of the eyes is closed and this infection has gone all over the way, most likely is they have to do an incision in this area and let the tissue drain, let the bacteria drain. This is another kid, when you see the eyes is closed, the bacteria is already even affecting the optical area. So it's very important that you be aware that this is not something that you're gonna take lightly. You have to be sure that you're going to the hospital, or an oral surgeon is the one that is taking care of that. Now, look at this, has a submaxillar right area before the abscess was draining this kid. To get a kid to this point, I don't understand what the parents are doing, but this is a kid that if they don't drain and if the pus doesn't come out, if they don't have access to a doctor, try to break that abscess with whatever you can. If you're in a town where you don't have access to a doctor, you have to find a way to drain this abscess of the kid, or the kid most likely will die. And what is the abscess? Is the infection that goes to the teeth and goes in here. But if you have a root canal after they drain, after everything is good, and this abscess is drained, and the root canal is done, but the crown wasn't done correctly, or when the root canal was finished, this wasn't sealed correctly, or the dentist didn't put the correct buildup here, it has to be a composite. A patient also has to cooperate. The patient has to go to the dentist right away after the root canal, where they're gonna seal this area and then they're gonna place a crown, and the crown has to be done correctly. But also, if you brush and floss at night, sometimes doesn't matter that it's a little problem, or maybe the crown is not that done correctly, completely 100%, then you floss and brush. But if you're grinding your teeth and clenching, even if you have a good crown, sometimes infection can still go in through, you break the seal of your crown, and then bacteria start getting into the tooth. Now, I have shown this image before because this patient was in an excessive amount of pain. And what happened if we finish this root canal, we have to be doing this root canal correctly. That means we open the tooth, we put a rubber dam, isolate the area they're gonna place a rubber around, isolating one of your teeth. And the dentist, usually what I did in this situation of my patient, I have a cannula very tiny, microscopic. I do microscopic surgery, and instead of doing a big incision we used to do in the old times, I enter with the cannula and I start suctioning all the pus of the patient until it's drained completely, and then I proceed to do the root canal. Place antibiotics is very important. That's why I place here, because this was prepared for a lecture. What I do, what I check, mobility, I do all the testing in these teeth, and they have to follow irrigation. And at the end, it has to be sealed in a way that is ready for the dentist to go inside again and place in this space a build-up, what is called a build-up, and a crown. So I usually, in this case, I just gonna present it to you. What happened when you do a root canal correctly? You ask your dentist, what is this round area? It's an infection. This is the destruction of the bone, and that's what you see, this round area around your root. This is a crown, this is the root, and this is the abscess. After the root canal is finished, then it has to finish all the way, and then this abscess that is here is clean. That area is clean. So it takes around 3 to 4 months, sometimes 6 months, so we can see that sometimes that the patient comes back after 7 months or a year, like in this case, and the bone already was rebuilt. And it comes fast in patients that are young age. So if you have this round black and it's cleaned correctly, the patient can come 3-6 months later, like in this case, and the bone already regenerated itself and heal itself, the area. And when you take an x-ray, then this black area that was here is not there anymore. That's when you know when your treatment was successful. But if the treatment was not successful, then it's gonna happen a failure, like in this case. So in my situation in my office, I bring the patients every 6 months, every year, and then every single year after the first 2 years, I bring them 6 months, and then every year for the rest of their life. Why? Because I want to see how my patient is taking care of a root canal like this. It's important the patient follow the rules of flossing, brushing, your rinses, use your toothpaste with whitening and fluoride. Whatever has fluoride is better. We have a topic about that I already presented, and we're gonna present later how to choose the best toothpaste and rinses, etc. But in this situation, the patient has to help, and if the patient is clenching or grinding, they need to ask the dentist to put a night guard, or ask the dentist, can you please check if I'm gonna need a night guard, which is gonna protect your teeth for destroying the work that your dentist did and to destroy the cement that seals the crown, and then the crown will fail with the root canal as well when there's any leakage of bacteria. And if you are flossing and brushing correctly, most likely you will be able to have a successful treatment for many years. What happened when this treatment fails? So this is a patient that has a crown. Look at this small black area, and this is a very old treatment I have. This patient is very successful until today. But if you look at the space here, this is a crown, and the crown was moving, bacteria was leaking, and around the root you see this black area. So this is the crown, this is the roots, and they place a silver cone in this area, which they were used in the 60s. This is the most interesting part, where the silver cones were placed around the 60s or 70s is not failing, but where the other somebody placed gutta-percha here, which is an excellent material, was not done correctly, the root canal was failing. Why? Because bacteria was entering through here. Remember, I talked before about this. Bacteria are 1 micron, and the dentinal tubules here, we have like a freeway. In these areas, our dentinal tubules are 3 microns. So bacteria reproduce every 20 minutes in big families, and is able to infect your tooth immediately, right away after you don't have anywhere if you have a space here, bacteria is going to get in. So when I opened the treatment of this patient, it was a very difficult treatment. I saw the big amount of pus coming out, and I let it drain. After I was able to remove the silver cone, first I removed the gutta percha, was the easiest way with the rotary instruments that I talked in one of the episodes about doing root canals in the modern area. We removed it and immediately a big amount of pus came out. I get all excited, it's gross, it's green, and the more I press on the chin of the patient, the more pus was coming. And then with the help of the ultrasonic instruments that I presented in another episode, we were able to bring the silver cone successfully, and more infection came through this coronal area. And after that, we clean again the treatment and we finishing. We place the material of obturation, which is gutta percha, and then this space that you see here is gonna have to be covered with a buildup. And a buildup has to have it's a composite, it's a resin. Your dentist have to choose the best material, and that's why as an endodontist myself, I usually place a material that is antiseptic, and it's Teflon tape, and I place Duralon until the patient see the dentist. It has to see within a couple of weeks, and once it's done, the dentist was able to redo a build-up here and a new crown, and the patient was successfully treated. So what happened in this case? In the old times we used to do surgery. Nowadays we can retreat because we have the help of the microscope. So there's no more excuse that we can have for that. But what is the easiest way? How do we take care of the complications? We are gonna floss and brush our teeth, so we're gonna avoid to have a root canal to begin with. But once we have it, also be aware when you're flossing and the floss gets stuck between the crown of two teeth, that means something is wrong, and you have to ask your dentist to take a look and to take an x-ray to avoid these complications and to avoid to run to the emergency room for a septic shock. Also, bacteria are proof now that the same bacteria that we have on the infected teeth are on the heart. In patients with heart attacks, we find the same bacteria. So be aware of all this, help yourself for your oral health and the health of your body. I hope you like this chapter. If you have any questions, send your comments to our channel, Dr. Fanny Yakaman, and in YouTube, and text to Instagram, and also watch in TikTok. Thank you.